Today we are going to talk about, again, pediatric orthopedics, and we have a lot of problems in this area, and especially congenital diseases are really tough, and I just want to really talk and give information about these children with disabilities. We have a lot of different pathologies in this child, and these are congenital. I mean, they occur before they give birth. So these are very rare, but these are really difficult to treat, and they have a lot of problems. Shortness of the limb and some ankle problems, knee problems. And in the past we have a lot of troubles about these issues, and we don't know how to treat these children, and most of them just don't have enough and don't have really good treatments. But today we know what is the pathology, and we have a lot of experience about these children, and especially we know where the pathology is. For example, one of them is very tough disease, very rare, but we see a lot of patients, unfortunately. Them is fibular hemimelia, which means the fibula, the thin bone in the leg, doesn't occur very well, and it affects all the part of the limb. It affects the ankle, affects the knee, and it's really tough. And some fingers are missing, and he doesn't use his ankle. So the treatment plan is about these children. So first of all, just to make an alignment and just to realize what the pathology is and what we have and what we can do this for this child. And in the beginning, it's a very difficult surgery. It's called super ankle. It's just defined by Dr. Paley and his team. And we are very happy about to experience this surgery, and we just use this surgery for a lot of patients for a lot of years, and now we understand how to treat them. So when the patient comes to our office, we just evaluate the walking procedure, how he can manage. He's a brave heart, this is very short, there is no ankle, fingers are missing, but he's still trying to walk, and he just learn how to walk, and it is functional. Just needs some help. And then just go to the operation room. We have a lot of techniques and show the operation room, the child in the operation room, and in the operation room not this one, no, yes, this one. So you see, under anesthesia before the surgery, we just get the X-rays and fluoroscopic images where are the bones and which are missing, and we just create a plan in the operation room again and again, and then so it's a really tough disease that takes hours and hours, but we know what to do. And after the surgery, just show that we have an ankle, and he can use his ankle. He can use his heel, and he can touch his heel to the ground, and it's really tough, but we have solved a lot of pathologies. Now we have only limb length deficiency. I mean, this is short, but he has an ankle. He can walk on his heel, and he can use his fingers. This is the first part. We have a lot of technological advantages now in our hospital, in our clinic. When we just have this, when we just evaluate, when we just get this alignment, after healing process, it takes around 2 months. We are going to plan for the lengthening. Lengthening issue is totally different, and is now totally based on the technological implants, and almost all of them are just computer organized and computer based implants. We are very lucky about them. In our country, in our clinic, we are able to use different technologies, and it's really help us. And especially we talked before about computers and how to affect the treatment process. For example, we have some lengthening device, especially we can show it in some patients. We have some different devices. These are external fixators. We just use them around the bone, and it's outside the body, it's outside the leg, and it's just controlled by computer systems. And so it's a three-dimensional lengthening and correction. We are so lucky, we have enough knowledge about them, and then we apply for them, for these children, to correct and sometimes to lengthening. This is another patient. This small child has also fibular hemilia problem. We use this external fixator with computer-based, and we just put this device under anesthesia to the leg, and then we just give all the information to the computer, and then we just talk to computer like what we want, what we need, what the child needs, how many centimeters he needs lengthening, and how the bone has to how the bone needs correction, and sometimes at the same time we do correction and we do lengthening. It's impossible to imagine by myself without without the computer support, because it's a three-dimensional correction. Just please, and then the computer just calculates everything for us and give us a receipt how to correct the bone, how to lengthen the bone. This is really good technology, and it has been used in our country for years and years. And then when we got enough lengthening, we just take the fixator out, and we do some casting, and then we let them to go. It's really helpful. For example, we have a lot of patients from other countries and very, very difficult disease. This is also another type of congenital disease. This is called tibial hemilia, and we just do the correction by this. Just show me this one. Yes, yes. It's a very rare disease, and we use this computer-based fixator to correct the bone, to lengthen the bone, and to give a normal shape. This one. Yes, this one. You see how to evaluate the lip and how to make the correction very slowly. It takes months and months, but it's really helpful. Otherwise, it's impossible how to manage. We don't have enough. We can't not use by ourselves. We apply this. We got this computer-based fixators, and it just corrects, and we just give information, and it gives us a receipt how to make correction. This is very tough disease, and we need these technological devices. And after then, we just straight limb with ankle, with knee, and the heels, and he can walk on his ankles, and this little one. Just show me this one. This one. No. Just go back. Yes. This is coming from another country, and now he has some shortness, but he can walk on his legs, and he can use his knees. Mama just sent us how he's walking. Just let me show how he's using his. Okay, he still have problems, but fortunately he can walk, and he can use his ankles. Today in our world we have a lot of different pathologies dealing with these children. In the past we don't know what to do. In our most of the countries didn't have enough technologies, but we are lucky, and we just improved our surgical techniques, and also we got too much help from different parts of the technologies. This is a combined treatment. Without these devices, it's not easy to just organize this treatment. This is a long trip. You don't have no chance to make mistakes, because it's totally tough disease, and you have to start in very small ages. And then after age and after years and years, when the baby grows up, you use different technologies to make some lengthenings and to make some corrections. And when the baby just grow up, and when the baby just became an adult, you have to finish up everything. What is your plan for 15 years, something like this? And we are lucky to use these technological implants. And today in our world, we have a very, very good results, and we are very happy to use them. Pediatric orthopedics, it's very tough branch of orthopedics, but the help of technology, and with the help of all of these devices, and with the help of families, and all together, we just every time, most of the time, we have very, very good results. So if you have a baby with pediatric orthopedic problems, especially congenital shortness of the leg, some problems about the deficiencies, knee problems, don't worry. Just be sure about your doctor knows the plan, the diagnosis, what's the treatment plan, and what you have after these surgeries. If you have a good plan, and if you have a good diagnosis, you will get good results every time. So thank you.